Hi everybody, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about staffing shortages in healthcare, and I'm going to try to provide some ideas or possible solutions to any deficits that you might be facing in your practice. It's no secret that there is a staffing shortage across the country in many different industries. This includes retail, food industry, and also healthcare. Unfortunately, it's causing a quite big dichotomy in my experience and what I'm seeing between the big industrial corporations and the smaller private practices, private businesses, small, tiny mom and pop shops, because it's hard for the smaller entities to compete with these larger entities. The larger entities have more money, thus they're able to throw bigger bonuses or sign-on bonuses to new employees. They're able to offer, in many times, better benefits when it comes to vacation time, sick time, medical, dental, vision coverage, retirement, and also overall pay. So the package that people are getting when working for these bigger corporations is going to be better, and a lot of people, especially with the rising costs of everything and us entering a recession right now, people need that extra money and they need to have that security. And so it makes it really hard for small private business owners to compete with that. Now, you might have staff that are fresh out of school and they're just happy to have a new job, or they don't have enough experience to get hired on at a bigger entity, or you have staff that have worked for the bigger entity and realize even though they have all of those benefits and good things, it doesn't still outweigh kind of the autonomy and the way that they like to practice medicine or that they like to care for patients. So they go back to the private practice and they take a little bit of a wage deduction or benefits deduction, but you're going to get kind of a mixed bag. In my experience at the allergy office, we would hire nurses right out of school and they would have their associates in nursing and they would be working towards their bachelor's, and as soon as they got their bachelor's, they would leave us to go work for the hospital because they got differential pay based on shifts and they got more money anyway and they got the experience, and a lot of people want to work in hospitals, and so it would always cause this kind of turnover. No matter how much we tried to vet candidates ahead of time and be honest with them that we wanted a commitment, it was just really, really difficult. So I have been in these staffing shortages prior to the pandemic, so I can only imagine now having to be a manager in these private practices what you are going through. So I have a few suggestions, and I don't know if it will work for you, but I'm just trying to help because I know it's really frustrating. My mom works in a small physiatry office here locally in Portland, and they have been struggling to find a front desk person for 2 years, and it has been nothing but a painful search with candidates that either lie on their applications or say they're capable of certain things which they're not, or they have the experience which they clearly don't, or they just don't have the work ethic or the dedication, whatever it may be. And so, you know, I'm kind of living vicariously through my mother and what she's sharing with me, and then I'm hearing it from other sources that I have connections to in the healthcare field. So I wanted to make this video and just put out a few ideas. Maybe they'll help you, maybe they won't, but I want you to know that you're not the only person experiencing this if you're frustrated or you want to give up, because it is across the United States. I have talked to people in Rhode Island and in Oregon and Washington and California and Idaho. So it's not just you. The one thing that a lot of people don't like to do is use a temp agency. And I totally understand that. It definitely has a lot of drawbacks. One is it's a lot more expensive. Two is, unless you know the people at the temp agency well and they understand your practice and what you're looking for, you might get candidates or people that maybe don't fit well with what you need, and it just causes some turmoil in your office. We all know that turnover is expensive. It's frustrating to patients, it's frustrating to providers, it's frustrating to your other staff, and we all know that unhappy staff can spread like wildfire, and you try to keep it down as much as possible, and you try to keep the people that are dedicated, they are hardworking and loyal, happy, and it's just a really tough juggling act as an owner and a manager. So that's one thing to know, is that maybe you should, if you haven't already, consider using a temp agency again. And the one benefit of that is that you can try people out, and if they're not a good fit, you can just tell them not to come back. You don't have to worry about the unemployment issues when it comes to all of the costs of that. You don't have to worry about paying their benefits right away. And you can definitely see if they are a good fit for what you are needing. A lot of times in the area, there will be temp agencies that specialize in healthcare staffing. So that means that they specifically know how to review and staff people on their service who are in the healthcare field, whether it's coding, billing, management, medical assisting, nursing, front desk. They know what to ask, what to look for experience, education, etc. And so they would be able to maybe do a little bit better job of finding you a better match than just going through a just common temp agency that finds and fills positions for all different types of jobs in every industry. So that's something to look for. If you're not sure about it in your area, I'm sure Google, it could be your best friend in that situation, and you could Google, temp staffing agencies specializing in healthcare in whatever city you're in or whatnot. I know a lot of people have said, I have put out ads on all of these different websites. I'm not getting any hits. I don't know what's wrong. And it's not anything you're doing wrong. It's just people are just not looking for what you're needing. And it makes it really frustrating. And if you do, they don't show up for interviews, and don't take it personal. I know it's hard not to. I know it's hard to not get down on yourself and get frustrated, but a lot of people in the industry are feeling the same way. The other thing I want to suggest is maybe looking at your existing staff and see if there's anybody there that might be interested in learning a new skill or helping out in a different part of the practice that might end up being able to transition there fully. I know this has a lot to do with your bandwidth on training or finding them the right places to go for the training and education, if you're willing to pay for it, if it's in your budget, if your schedule would allow for them to take some time off to do that education or that training. But maybe it's worth doing a perspective look into your existing staff to see if any of them want to wear multiple hats and maybe transition fully into a different department. And maybe if you see potential in somebody, maybe they've never even considered doing billing or coding, but you recognize some qualities in them and talents that they would be good at those positions and they're just not aware of it. So have a conversation with them about it and see if they're willing to even part-time try it out and see if they like it. Maybe that's going to be the solution. I know it gets really hard to have your hours open to treat patients when you're short on staff. So do you need to work longer days but be open less days of the week? Like maybe have 4 10-hour days instead of 5 8-hour days. Or maybe if you're open on the weekends, close one day of the weekend or close both days of the weekend. Maybe do some kind of survey with your patients to see what hours they prefer so that the hours you're open are going to be the most beneficial. Of course, you want to talk to your staff too, because a lot of them have families and other obligations where this might affect them, and you don't want to force them to quit because of your changes in hours or days. But it's definitely something that you need to be realistic and honest about with yourself as the owner or the manager, and also your other providers, and with the staff. Just be very transparent. We've been trying to hire for this position. We can't find anybody. So our temporary solution is A, B, and C. And so we're hoping that you guys will be flexible with this, and we'll see how it goes. We don't want to have to do this, but it's better than having to lay somebody off because we're not getting in the patients that we need, or closing the practice completely because you're understaffed and you just don't feel safe seeing patients. I mean, there's so many things that could happen. So I think just being really honest after you've approached and looked at all options with your staff and other providers, and just saying, look, this is where we're at and we need to make a decision. And it doesn't mean it's a final and permanent decision, but it could be a temporary position. But what do you guys think about this? Or this is how we're going to do this. What do you need from us to be able to help make this work for us? Maybe if they need help paying an extra hour or two of daycare a day, maybe you can help do that if you're going to be staying open longer. I mean, there's different things you can get creative with, but definitely showing them that you don't expect them to just be able to make changes on a whim, but also also that if they want to keep their job and if they're happy, that there's some sacrifices that need to be made by everybody, at least temporarily, until things can change. That doesn't mean when things are changed temporarily that you stop looking for that position or hiring or training for that position, but it's definitely something that will help maybe take some of the pressure off you as the owner or your management or the people who are working like dogs because you're short-handed. There's different solutions. They're not always ideal. Sometimes it's hard to think about and you just have to be like, okay, it's temporary. I'm not happy about it, but it's the better of the two evils. And, you know, it comes to a point where you just have to have those honest conversations with yourself, with your staff, and also with your patients. I hope maybe I threw some ideas out there that maybe sparked another idea that I didn't mention, or you thought of something that is related to something I mentioned that you're like, oh yeah, that would work if I do this, or wow, I never thought of that. It's just unfortunately the times we're in right now, but just know that you're not alone, that there can be some solutions, even though not desirable solutions. There could be some temporary, at least, solutions for you to try to make this work. And, you know, when at the end of the day, it comes down to patient safety, being able to provide patient care with that patient safety, keeping your staff as happy as possible and not overworking any of them or yourself or adding additional stress when you can make a simple decision that maybe isn't the most popular idea or decision, but it will help for a little while, buy you some time until you can come to a more permanent solution. So if you have any comments, suggestions, questions, please leave that in the comments below. I am sure everybody watching this would like to know if you are also struggling with these kinds of things and what you've done to try to help mitigate any kind of issues that arise. So please share that with everybody. Take care of yourself. Remember to try to get some R&R for yourself. Even being a business owner, you do get to be allowed to have a little bit of fun and relaxation in your life. Smash the thumbs up button if today's visit was helpful. Subscribe to my channel if you haven't already, and we will talk soon. Thank you. Bye-bye.